The Ministry of Public Health is seeing less than 500 cases of newly reported infections yearly, and the adult working population is ranking high on the chart. But based on a surveillance survey conducted by the ministry on in and out of school youths are adopting worrying trends. Here is former National AIDS Program Secretary at NAP's Program Manager, Dr. Shanti Singh Anthony, who is now the Knowledge Management Coordinator, Care for Health PANCAP project.
There has been a reduction in condom use among the in-school population as well as the out-of-school population. There have been increase in riskier behavior, so the age of sexual debut, for example, was decreased from the first BBSS to the second BBSS.
There's no specific information on the infection rate among young people. However, it is estimated that some 7,800 persons in Ghana are living with HIV,
which really translates roughly to a prevalence about 1.3%. The estimates, the way they're generated, generally do not provide an estimate for the number of young people. What it does show is the number of new infections that would have occurred within the 1 year period.
Global funding for support programs aimed at combating the transmission of HIV and prevention initiatives has been dwindling over the years. But for Minister of Public Health Dr. George Norton, Ghana needs to go back to basics.
When the HIV epidemic hit the world, everybody was afraid. It was literally a death sentence. And then over the years, with all the progress that has been made, treatment becoming available, it turned out to be a chronic disease, so to speak. And the world over, persons tend to have lowered their guard, so to speak. We cannot throw caution to the wind.
Derek Springer is the director at the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP. He feels more emphasis must be placed on prevention.
It means that PANCAP has to advocate with national governments for them to increase the domestic resources, because national governments are spending on HIV, but to increase those domestic resources to fill those gaps, particularly in the area of prevention now.
The remarks were made during a media breakfast on Monday at Carroll Lodge, where PANCAP announced its partnership with the Care for Health project on knowledge generation and sharing regarding the WHO Test and Start guidelines on HIV and AIDS. It's a project that's being funded by PEPFAR for an 18-month period. Handel Duncan, HGP Nightly News.